Alright, so you guys remember like Corinne the other day, like if you have limited ankle dorsiflexion, what's the joint that allows dorsiflexion in the ankle? Talocrural joint, right? So this technique, literally all you're doing is what I do is I do a hand over hand technique. So I grab her ankle with one hand and I take my other hand and I lay it on top. And all you do is you pull, right? So you don't want to pull like this, right? Because that means Iva's going to come towards the table.
That's good.
Pooja gonna come. I was looking at Iva. Pooja's gonna come down on the table. It's like never mind. So we're here. I'm gonna say you guys are inseparable, so it's like you're the same person.
I thought you said because Asians look alike.
She's Indian.
Which is
You're
not
Indian,
Asian.
so-
Technically, India isn't Asian.
It is in Asia, but so
Wow.
be careful pulling here, because look, all my force is going into her hip. I don't want it to go in her hip. I want it to go in her ankle. So if you kind of push her heel down into the squishiness of the table and then pull, you get distraction that way. So without pushing down on the table, she's already popped. And if you push down and scoop and pull. So hand over hand technique and you're pulling, right? That's distraction. Subtalar distraction is different, right? Because it's where it's underneath your talus. I don't, yeah, there it is. So it's no longer a hand over hand technique. You're going to try to cup the heel with your hand, right? So your inside hand comes in, cups the heel. Your top hand comes in, and you're going to want to find neutral, right? So basically where her foot doesn't want to move either direction is kind of in the center. Take your top hand and lace it over, and now into the table, and then you're distracting. Some people might find it easier to wrap this way, so play around with it. Some people like it this way. It's whatever you're more comfortable doing. So find where the ankle's about where it should be, and then distract. Okay? Ankle dorsiflexion requires a posterior glide of the talus, right? So what I do is you can use your web space of your hand, right? And all you're going to do is kind of stabilize her leg and then push down. That's a posterior glide. You can use your thumbs, find the joint, dorsiflexion, and push down. That's another way of doing it, right? Huh?
You know, my foot stuff.
Yeah, I know.
You know.
Sorry. Yeah, those are the two other ones. Okay? The anterior glide is here, right? So you stabilize your tibia with your top hand, bottom hand comes this way. You're putting your hand over the calcaneus and you're pushing forward. So I always like to put my hand here where the table is because I'm pushing down pretty hard. It hurts if I do this. It doesn't feel as comfortable. So if I put my hand there, I can judge like how heavy of a pressure I'm putting on her ankle.
So you're kind of wrapping your hand, pushing.
Yeah, I'm grabbing like this so I can stabilize and I'm pushing forward. So a posterior glide of the talocrural joint helps with dorsiflexion and anterior glide helps with plantar flexion. You do a lot less plantar flexion than you will dorsiflexion. You do a lot more dorsiflexion glides, right? So lay on your back again. Sometimes patients can't lay on their stomachs. So an alternative to that one is you stabilize the foot and now you put your hand on the tibia, right? And then I can push posterior on the tibia. That's a relative anterior glide on the foot, on the talocrural joint, right? So posterior glide of the tibia here is the same thing as doing that. Tricky one. All right, practice those.